morning and welcome to the Health and Social Services meeting of Thursday, April 4th. I'm going to do a call of the roll, but I'm also going to note that some members online are still trying to get online.
Councillor Anderson?
Okay, and moving on to any declarations of pecuniary interest in any items on our agenda today. Hearing none, I'm going to move to the adoption of the minutes from March 7th. Can I have a mover? Councillor Brenner, second by Councillor Dyes. Is there any questions? Hearing none, seeing none, all in favor? And any opposed? We have no statutory meetings. We do have one presentation. Michelle Brawley, Manager of Population Health Division, and I know that there's somebody else behind the podium. If you could just come on forward, it's the immunization program, and if you could give introduction as well. Good morning.
Good morning. Thank you, Honourable Chair and members of the Health and Social Services Committee. Thanks for this opportunity to present the immunization program. Whoop, went too fast there. So the goal of the immunization program is to reduce or eliminate the burden of vaccine-preventable diseases through immunization. For over 50 years, vaccines have saved the lives of millions of infants, children, and adults, and helped prevent the control and spread of serious diseases. Ontario Public Health Standards outline the requirements for immunizations, including ensuring children have up-to-date immunizations, ensuring access to provincially funded vaccines for eligible persons, including underserved and priority populations, ensuring effective inventory management of provincially funded vaccines, investigating adverse events following immunization, and increasing public's confidence in vaccines. Given these requirements, the following are the programs and services we provide: Immunization of School Pupils Act, ISPA, Child Care and Early Years Act, CCEYA, Vaccine Storage and Handling, Adverse Events Following Immunization, our immunization clinics, and vaccine promotions. Over the next few slides, I'll provide additional details about each of these services. We'll start with the Immunization of School Pupils Act, or ISPA. The Immunization of School Pupils Act is provincial legislation that aims to increase the protection of students against vaccine-preventable diseases. This legislation applies to all students attending school under the age of 18. The Act states that students attending school must follow the publicly funded immunization schedule to ensure full protection against 9 diseases. This includes tetanus, diphtheria, pertussis, polio, measles, mumps, rubella, meningitis, and varicella. The Act allows for parents, guardians, and students to pursue exemption through conscious religious beliefs or through medical reasons. This year, we have fully enforced ISPA in all grades in high school and in grades 2, 5, and 6 in elementary. This entails sending notices to parents, guardians, students to which vaccines are overdue and would result in a suspension if not updated by the date noted on the letter. We support students get overdue vaccines for those who do not have access to healthcare provider or OHIP coverage, or those who are having difficulty accessing their healthcare provider. We also support parents through the exemption process if that is what they're requesting, and we work with the school administration staff, including the school board, to help prepare for suspension day. I'll move on now to CCEYA. The Child Care and Early Years Act, again, is provincial legislation that aims to increase the protection of children against vaccine-preventable diseases in licensed child care settings. We are currently planning on enforcing CCEYA this year. This involves communicating directly with the licensed child care setting to request updated immunization records and attendance. We assess the immunization records and communicate directly to the child care settings on which children are overdue or missing immunization records. For both ISPA and CCEYA, immunization program assesses, maintains records, and reports on the immunization status of children in licensed childcare settings and students in schools as defined by the applicable act. During the COVID-19 pandemic, there was a decrease in the overall immunization rates among children for routine, childhood, and school-aged vaccines. As a result, there are a large number of children who are either unimmunized or underimmunized. By enforcing ISPA and CCYA, we ensure that children and students are up to date with their immunization in order to increase community coverage and reduce the incidence of vaccine-preventable diseases. I'll move now on to vaccine storage and handling. The immunization program manages and distributes publicly funded vaccines to healthcare providers within Durham Region. Each year, we inspect more than 480 fridges storing publicly funded vaccines to ensure vaccine is stored correctly. We investigate instances where vaccine is stored outside of the recommended temperatures to ensure a vaccine is safe and effective for administration. We provide healthcare providers who administer publicly funded vaccines with vaccine education, including vaccine waste reduction strategies. Nurses respond to after-hour fridge temp alarms for health department vaccine fridges. This year, Durham Region has supported the distribution of publicly funded vaccines, including Imvamune and the RSV vaccine, along with the COVID-19 vaccine formulations. Adverse events following immunizations, or APHIs, can be defined as any untoward medical occurrence in a vaccine recipient which follows immunization that cannot be clearly attributed to other causes. In Ontario, regulated healthcare professionals, such as physicians, nurse practitioners, nurses, pharmacists, are mandated to report APHIs. We investigate APHIs and provide individualized vaccine recommendations to healthcare providers and clients. These recommendations may help to reduce vaccine hesitancy and with the continuation of immunizations. From January to December of 2023, we investigated 235 APHIs. This includes COVID and non-COVID vaccines. Reporting on APHI provides important information for us to monitor vaccines. This information is used to report on vaccine safety in Ontario and highlights the success of immunization programs across the province. School clinics. We provide hepatitis, meningococcal CACYW135, and HPV-9 vaccines to eligible grade 7 and 8 students through the immunization clinics in schools. During the fall campaign, from September to December of 2023, we followed up with 18,348 grade 7 and 8 students, led 190 school clinics, and provided 21,734 vaccines to 868 eligible students. The region of Durham historically has had very high vaccination rates for school-based vaccines. For example, in 2018, Durham Region's vaccine coverage of school vaccines were among 12-year-olds was the top 3 out of all health units in Ontario. Catch-up clinics. So we offer routine catch-up clinics for eligible residents at various locations across the Durham region. When we think about the catch-up clinics, our target populations are students in either elementary or high school, and people who have barriers to accessing healthcare, for those maybe who don't have OHIP or for without a healthcare provider. In 2023, 43 catch-up clinics were provided with 4,171 vaccines administered. Currently, we are running approximately 3 to 4 catch-up clinics per week. This includes evenings and weekends. This is critical. As I mentioned earlier, we are enforcing ISPA and CCYA. We want to ensure the residents have access to vaccines. To date, in 2024, 41 catch-up clinics have been provided. COVID clinics. In 2023, 169 community-based COVID-19 clinics were provided by the immunization program, including 67 pop-up clinics to support identified priority populations, as well as 24 homebound clinics to support residents unable to leave home due to mental, physical, cognitive, or psychosocial conditions. To date, in 2024, we have provided 10 community and homebound clinics. We are currently planning the spring 2024 campaign based off ministry guidance. Eligible residents can obtain a COVID-19 vaccine through their healthcare provider or pharmacy. Vaccine promotion. Vaccine promotion is a very important part of the immunization program. We utilize health department social media platforms to promote immunizations, to decrease vaccine hesitancy. This includes messaging around fall respiratory season, including the COVID and flu vaccine, information about ISPA, information about our catch-up clinics, and information about vaccine safety. We also utilize Durham.ca to provide accurate information about immunizations for both adults and children. This includes information about vaccine safety, effectiveness, our immunization clinics, information around ISPA CCYA, and information around the Ontario routine immunization schedule. We also have a portal for parents or guardians to submit their child's immunization record. We provide regular updates to our healthcare providers to promote immunization, to communicate changes regarding extended eligibility of certain publicly funded vaccines, how to order vaccines, and ISPA enforcement, and any vaccine packaging updates. I'll now talk about some challenges and opportunities that we're experiencing. That these definitely have a impact on our immunization services. So higher demand for immunization. People did either not have access or did not seek out routine appointments during the pandemic with healthcare providers, which led clients to being either unimmunized or underimmunized. Difficulty or decreased accessing primary care providers. As I mentioned earlier, some people do not have access to a healthcare provider, or if they do have access to a healthcare provider, at times they have difficulties accessing the healthcare provider. With our urgent care clinics, at times pre-pandemic, people were able to go to the urgent care clinic and get a vaccine. Now we know that some urgent cares are not offering that service. Vaccine hesitancy is defined as a delay in accepting or refusing vaccines. Vaccine hesitancy is a very complex issue influenced by many factors, such as complacency, where the perceived risk of the vaccine preventable disease are low, and the vaccine is not perceived as a necessary preventative action. Convenience, looking at things of availability, affordability, geographical accessibility. And then confidence, trust in the effectiveness and safety in the vaccine, the system that delivers them, and the motivation of the policymakers who decide on the need for vaccine. Vaccine hesitancy has historically challenged immunization efforts. According to Public Health Ontario, a lack of trust and vaccine hesitancy that emerged during the COVID-19 pandemic are barriers to the uptake and catch-up of routine immunizations. We know there's a lot of misinformation on social media, and this does reinforce vaccine hesitancy. We are also seeing polarizing views as it relates to immunization. During the pandemic, conspiracy theories were rampant and created doubts about the interest of organizations promoting vaccinations. This opposition to vaccines is becoming more confrontational, and we are experiencing this during our interactions with clients regarding immunizations. This includes clients who are steadfast in their beliefs they are not obligated to follow any provincial legislation regarding immunization. Decreased access to immunization and vaccine hesitancies results in lower vaccination rates. With lower vaccination rates and with the addition of world travel, we will see an increase in rates of vaccine-preventable diseases, such as measles. Understanding the challenges is really key for us to being able to identify opportunities. As mentioned earlier, for school-aged children who are experiencing difficulties accessing routine immunizations, we offer catch-up clinics to increase access. Given that we're enforcing ISPA and CCY this year, as I mentioned earlier, we have increased our number of appointments. We communicate with our healthcare providers, informing them of ISPA and the need to ensure that students are caught up to date. We also provide information on our website about medical clinics that are willing to provide immunizations to clients. For vaccine hesitancy, having an understanding of the current perspectives among individuals that are vaccine hesitant or struggling with vaccine confidence is important. We implement targeted campaigns to counter misinformation on social media and provide transparent vaccine information, such as having evidence-based information on our website and with our posts on social media. In our interactions with clients, ensuring that they are accessing reliable sources of information that supports them in making decisions about their health. In conclusion, the immunization program continues to modify and prioritize our service to meet the increase in demands and to build public trust in public's perception and view of vaccinations post-pandemic. Thank you.
Thank you very much, Michelle. And Mayor Foster has a question.
Chair Roy, thank you. My apologies, having some challenges with one piece of technology, but managed with another piece. Michelle, on the vaccine hesitancy is a very polite phrase, but looking at the measles more recently, I used to be a member of Rotary, who thought that they were going to get rid of polio entirely. That sadly not the case. Tuberculosis was something thought to be an issue of the past. The communications that you are trying to do, would it not make a lot more sense for the province, the federal government, to be doing a consistent, persistent, focused piece of communication?
Thank you for your question, and through the chair. That's a real tough question to ask. I know provincially there is lots of information, and we are sharing the information through social media posts, through information to our healthcare providers. We know that there is information on our Public Health Agency of Canada with regards to measles. There is messaging around, ensuring people are checking their immunization status before traveling, making sure they're up to date with all their routine immunizations. So I think there is work going on. That's really all I have to say. I don't think I can comment on the federal system.
That might be perhaps was too political to ask of staff, but I'm not sure that anyone who has chosen to believe or disbelieve science or anyone who has hesitancy is going to search out those resources and change their minds. So we may have some talk later. Measles and the vaccine. So I'm even a little bit confused. I would have been vaccinated as a kid. I might have had one or two beats me. It would have been many, many years ago, as you can tell. Can you provide any suggestions? And I've actually been searching out whether I should get a booster based on measles vaccinations. Are you in a position, and you may not be in a position, to provide some guidance on that?
Yes, thanks for your question, and through the chair. So there is recommendations for people to make sure their immunizations are up to date. Those born before 1970 have likely gained natural immunity through measles. Everyone else would have had one dose of MMR up until I think it was 81 or something like that. I forget the age. I'm looking at Pappy, but I think it's 81. And then we started with a 2-dose series. I could be wrong with that, so please forgive me if I've got the year wrong. But at this time, there's no recommendation to go ahead and have a booster dose. That recommendation hasn't been made yet.
Okay, no, it'll shock you, but I was in fact born before 1970. The entire room is amazed by that, but all good. Michelle, thank you. Madam Chair, thank you.
Thank you, Mayor Foster. Mayor Schumer.
Thank you, Madam Chair, and thank you very much for that presentation. And yeah, we all know that there seems to be an aversion to vaccinations and immunizations. One of the exemptions you mentioned was based on conscience. Um, can you elaborate on that? Because you know, it seems all too often there is a desire to come up with some reason not to have it done, especially for children. And then that decision, of course, is made by the parents. But can you elaborate on that exemption for conscience? What is how that's permitted?
So people have many reasons why they don't want to get the vaccine or have their children get the vaccine. So through the legislation, they are allowed to apply for an exemption process. The exemption process is for them to review a video on vaccines, and it talks about vaccines, the safety of vaccines, the effectiveness of vaccines, and the risk of not getting a vaccine. Once they get that done, then they can get an affidavit signed. And once they have those pieces together, they are exempt. So they might be exempt from one vaccine, they may be exempt from all vaccines, depending on what they're looking for. And then once that exemption's in place, then the child will not be suspended based off that. So there's many reasons why people don't want to get vaccines. As I mentioned, it's a very complex reason. And for some people, it's one or two vaccines. Others, it's the whole range of both childhood and school-aged vaccines. And so their reasoning,
Oh,
like for me to be able to represent them and say all the reasons why they don't, a lot of the diseases that we are vaccinating for are diseases that aren't necessarily up. And I think what we talked about earlier, like we haven't seen polio as much, and we haven't seen like measles as much. So those diseases that people are that we're getting routine vaccinations for may have never had somebody or known somebody who has had polio, for example. So kind of people don't have a reference point to be able to understand the risks associated with not getting vaccinated.
yeah, it's just I mean, it's been in the national news for years now, and especially since COVID. The need for vaccinations, and it's been shown that we're having outbreaks where we shouldn't have had them before. And to me, and this is just my personal opinion, but that exemption for conscious just seems like the easy out. It seems like, well, if I can get it under that, fine, I'll watch a video for a few minutes, and my child's not going to be vaccinated, and then that puts the entire school population in that community at risk. It seems to me ridiculous to put such an easy exemption in there. And I'm not sure how we can stop any child through their parents to not be vaccinated and attend school. It just seems this gives them the easy out. And, I mean, as as you've talked about, the misinformation, and people buy into it, and they buy into it wholesale. And it doesn't matter what facts you put in front of them. It doesn't matter what proof they are given. They come hell or high water. They are going to say, you're wrong. I'm going to believe this online source. Whether it's vaccinations, climate change, whatever it is. So it seems like, and I know this is not your doing, not your fault, but it seems the province has caved in providing people that level of out. Is there any lobbying being done to address this exemption, which, quite frankly, once again to me, seems ridiculous?
Yes, thanks for your question and through the chair. So I just want to bring us back to the exemption process. So as I explained the process, but I'll just give you an example. So say there was a measles outbreak in a school. I'll use that example because it's kind of maybe on our mind. For those who are not up to date in their MMR vaccine, so whether you received an exemption or for whatever reason you're measles, mumps, and rubella are not up to date, you will be exempted, you'll be excluded, sorry, from the school if there was a measles case in that school for 21 days. So it's really important for people to understand if they're going through a route of exemption, first of all, to be able to understand the risks associated with not receiving the vaccine, but also if there was an outbreak of a disease that they're not up to date with, that would also then result in them being excluded from school from a period of time. So and so that's to protect them as well as to protect the other people who, for whatever reason, for maybe medical reasons, are not able to accept or be able to have the vaccine. So this is provincial legislation, and we follow the legislation here.
Yeah, and I get that. It's just, chicken and the egg kind of thing, right? Chances are that measles outbreak at the school that you're talking about was probably caused by somebody who wasn't vaccinated. So, it's great that after the get the horses back in after the barn door is closed. But thank you very much for the presentation.
Thank you, Mayor Schumer. Chair Henry.
Thank you, Chair Roy. Michelle, great presentation. I'm going to dwell on vaccines, but a little different topic. There are vaccines that are you're able to get by pharmacists, and the challenge is, pharmacists are highly skilled, talented people that can give vaccines. My wife's a retired pharmacist. I have no conflicts, but there's a fee attached to that. It's $20 to get a vaccine, whether you get it for Shingrix or you get the one for Hep, but there's a number that you can get. Shouldn't it be that, and it's a political question, but shouldn't it be able to be passed on to the government? They don't support our clinics anymore the way they used to, and for some people, $20 can be a lot of money to go get an injection. Do you think that's getting in the way of some of the other challenges that we're having?
Yeah, I think when I mentioned about vaccine hesitancy, affordability is an issue that for some they have to make decisions about whether or not they can afford to get it, and so I think people do make choices of what they can and cannot afford. COVID vaccine, flu vaccine, those are all free at the pharmacist, but there are the other ones that the pharmacist choose have a fee associated with it. I think your healthcare provider wouldn't charge a fee for that. I think that's...
You're correct, except there are not enough doctors to make sure that our population can be served. So for seniors and for people that don't have family doctors, it's my opinion is that if you go to a pharmacy for an injectable vaccine, that should somehow be paid for by the province to encourage people to go out and get those. So I'll leave that with you, Chair, on how you want to, whether we should write maybe not.
Chicken. I think we should, because it is a very important topic, and it is one that we should be advocating for. And as the pharmacies are now starting to do more, even with the diagnosis of matters as well, this is a perfect example where there should be that work done as well too and covered. So would you like to write it, Chair Henry?
I'm happy to move a motion after this presentation is done that says that vaccines that are injected at pharmacies, that the pharmacist should be remunerated, but they should be receive their funding through OHIP. And they should just have to submit who's been vaccinated, and they would get paid the same way that someone would if you went into a doctor's office. Yep. So how we word that.
So we have no speakers, any more council members? Is there any others who would like? I have no more on the request, so you want to go forward with that motion? So
I'm going to look to Dr. Kyle and Dr. McTavish for help with this, but I'm happy to move that that the Region of Durham asks the Minister of Health at the province of Ontario that when an individual goes into a pharmacy for a vaccine, that those costs be recovered the same way it would be if they went to a healthcare provider. Is that reasonable?
I can't speak to the reasonability, but we hear where you're coming from, and we'll draft correspondence accordingly.
So if
Do you
you're
want to take
able
it as
to,
direction, or do you want to do it as a motion?
I think direction from the committee, if you're willing to
Yeah.
accept that.
Is the committee in favor of that? Mayor Foster?
No, I was going to second a motion and didn't have a chance to click off.
Okay.
So I'm good, thank you.
I think what we're going to do, if the committee's in agreement, I think it'd be direction to staff.
And that it be circulated not just to the appropriate ministers, but also to AMO and to our healthcare networks, the ones that the region works through, so that we may be able to get more people vaccinated as pharmacists are given more opportunities to, but it's not fair to a pharmacist not for them to be paid.
No, I agree.
Okay, thank you.
Yeah, thank you very much. Thank you. There's
Thank
no
you.
more questions, and thank you for what you do.
Thank you. Thanks for your time.
Thanks. And moving on, we have no delegations. We have no reports from health. And we are moving to the report of 8.2, the Region of Durham Community Security and Cleanup Policy. Can I have a mover on this? Councillor Anderson, Chair Henry. And I know that we have from Mayor Carter an amendment. So Mayor Carter, you were on. Mayor Carter.
Morning, Madam Chair. And I know that Regional Chair has an amendment that I think that he's going to present. I do have some questions before we go to the amendment. Is that fair?
Yes, please go ahead.
Okay, thank you very much. Mr. Chairman, thank you and good morning, sir. I just want to get some clarifications in regards to this report. And I do appreciate the time that staff have gone over this. And I read it 19 times last night, and every time I read it, something else came up. So I just wanted to kind of get some clarification. On page 28 of 32, on the report 2024 SS3, attachment 1, the whole concept behind this is directed just at shelters. And at the bottom of this page, it says warming centers, homeless hubs, transitional housing facilities, supportive housing facilities, community housing are not included. And I'm a little concerned in regards to that because our warming centers and our homeless hubs are, in many circumstances, are funded by the region that are providing a service that is vital in regards to the most vulnerable. And I'm wondering, would that eliminate them from this program altogether based upon the description here, Madam Chair?
We'll get you that answer, Mayor Carter. Commissioner?
Thank you.
Yes, thank you. Through the chair. Mayor Carter, there is an opportunity in the report that speaks to having a discussion around needs in the communities where there is identified needs. So we don't want a blanket statement that every warming center will require this service, but we will have those discussions as they arise.
Okay, that's good. I appreciate it, Madam Commissioner. I do have another question just in regards to a couple other things here. We talk about security services. Do we know what level security services are they? Are they a level 4, a level 2, a level 1? What type of security services are being provided at these locations?
Lisa? There you go, you're on.
So our security services are not the same type of security that are in downtown Oshawa at the moment. Our security services are, they are responsible for reporting to police services, criminal activity, and engaging in de-escalating individuals, but they do not operate on the same level as the ones that are in downtown Oshawa.
So would they be a level 2 or a level 3 or level 4? If they've got
They're a
de-escalating
level
training,
3, which is
Level
what we
3?
had in in the what we usually operate with in our warming centers or community, and we do engage and have security guards who have different levels of capacity based on the site and what is required. You know that with each level comes a different type of funding.
Yep. Yep. So I'm just curious, and I mean, again, it's level 3 and level 4 gives them the medical training. It also gives them the de-escalating training, and that's really important in regards to the complexities that you're dealing with. So that's great. I really appreciate the description on that itself. I had something else here. Just give me a second here, Madam Chair, if you don't mind. Just out of curiosity, to our commissioner, through you, Madam Chair, this is a unique program that the region of Durham is doing, is it not? I mean, other regions aren't doing these type of programs. Is that my understanding?
Commissioner?
Yes, through the chair, we did do a reach out across the province, Mayor Carter, to find out who is funding these types of programs. We didn't receive much back. There is some consideration in certain communities, certainly, especially today with the rise of homelessness and other issues.
Great. I appreciate it. And I appreciate the opportunity to be able to ask some questions in regards to this report. And Madam Chair, I cede the floor to Chair Henry because I believe he does have an amendment, and I'll support the regional chair's amendment that is being brought forward. And I thank you for the opportunity to ask questions on this report.
Yeah, thank you, Mayor Carter. Chair Henry?
Thank you, Chair Roy. I do have an amendment, and it can be placed in the report where it needs to be placed by staff, but it would read, in those limited areas where there is demonstrated need for additional services and supports for vulnerable populations, staff be instructed to meet with local officials to discuss area-specific requirements should the need arise and to report to council on the outcomes of such discussions.
And do we have this to put up on the screen? So this is an item B into the main motion. Seconder, Mayor Carter, I assume. And to Mayor Carter, you're confirming?
Yes, I am. And I just, once the chair has an opportunity to speak to it, I may have a couple questions through you to the Chair Henry.
Thank you. Chair Henry, would you like to speak to this?
Chair, thank you. I think it's self-explanatory that each of the challenges we're having are ongoing. The environment is changing on a daily basis, and this will give us the opportunity to meet with all 8 communities as the need arises. So,
thank you. And as the seconder, Mayor Carter.
Well, first of all, I just want to say thank you to the chairman for bringing this forward and staff to be able to understand the complexities across 8 different municipalities. So I really appreciate it. I also appreciate the commissioner really looking at a unique approach in regards to the complexities of this issue. I think that's really important, and I'm assured through Chair Henry that based upon this amendment, there's a fluidness to this particular report, that we're trying to do the best with the resources that we have and understand that there are unique challenges in all 8 municipalities, and how we can address it and not be so rigid but flexible. I think we'll be able to help all municipalities as we see the changing environment. And I just really appreciate it, Madam Chair. And I really do appreciate the work that the staff has done previously to especially help the city of Oshawa and the efforts that have been put forward there. So thank you, Madam Chair, for the opportunity to be able to speak to it. And to Chair Henry, thank you for your leadership on this.
Thank you, Mayor Carter. Mayor Schumer, to the amendment, and I know you wanted to speak to the main motion too.
It's not on the amendment. Thank you.
Okay. Mayor Foster, to the amendment or to the main motion?
Yes, actually, the same question would apply for both. So the amendment in front of us and following up, it's essentially the same question that Mayor Carter had, but I'm not sure I quite get the answer. I'm hearing this is fluid. You're talking to municipalities, but this is not specific to shelters. So a warming center, obviously, if we needed help around that.
Mayor Foster,
Cleanup,
just to
and we
correct,
do.
yeah, just to correct, this is strictly to shelters, not to the warming centers.
Okay,
But we
so
will
I
have
will.
discussions about the warming centers.
Okay, so I will. I'll go back to the main motion and a couple of comments. I'll speak to it as
Okay.
opposed to the amendment. Thank you.
Okay, appreciate that. Anything to the amendment? Not seeing anybody. All in favor? Any opposed? That is carried. I'm going to return back to the main motion as amended, and Mayor Schumer.
Thank you, Madam Chair. Just the report speaks to regular discussions with the local area municipalities. Can you just enlarge on exactly how or when that was taking place, and if there were, specific concerns raised that that might have altered the final policy?
Can you repeat that again, Mayor Schumer? Just the last part of it?
Okay, so there were discussions with local area municipalities. If I could just understand what time frame that was taking place on, and if there were concerns raised by any of the local area municipalities that may have affected specific areas of this policy.
CAO?
Thank you. Through you, Mr. Chair. Through the commissioner and her team, there's ongoing discussions with all 8 municipalities around the various services that are provided. What gave rise to this policy was simply recognizing that it wasn't viable to go through an MOU negotiation process every time the region had to open a shelter. So we wanted to make it clear in terms of the services that we would provide in and around shelters should they be required. Obviously, as clarified in the motion by the chair, if other issues arise that weren't anticipated, we would continue to have discussions and take any actions necessary. But we do not want to go through the MOU process going forward, recognizing that providing shelter is a core service that we're legally required to provide.
Further, Mayor?
Okay, so am I correct in understanding that these discussions that are referred to in the report probably took place in the last maybe 2 or 3 months?
CAO?
Yes, I think that's safe to say. I know in Brock, for example, it would be through the Community Advisory Committee. So there's ample opportunities to get feedback from both staff at local municipalities and residents.
Okay, and I guess my last question on a similar note would be, once this policy was drafted, was it sent out for comment to the local area municipalities?
No, it was not.
Okay, thank you very much.
And Mayor Foster.
Thank you, Madam Chair. So just a couple of points. I think we have a wonderful opportunity for regional staff to be gathering information and sharing with the lower tier municipalities their experiences, things that we maybe hadn't thought of on the local level that we will be experiencing. Just very quickly, and understand that that this is focused on shelters. It's going to be important that the Durham region provide services, and I know they are already, but provide help on a variety of other things. Warming centers are the easy ones that come to mind. We do have an issue where we are legally responsible for doing this, but we're morally and ethically responsible as well. On the other hand, we need the support of the community. I can tell you, Clarington, and thank you, Commissioner, for the help and the presence of your staff there. We are getting a number of complaints with drug paraphernalia, garbage, whatever. While you can't necessarily make the correlation to the warming center, the optics are so very important that we're able to provide the services that we need to provide, and that the communities feel comfortable. So So that's a little mini rant. And I'm going to follow the mini rant again with congratulations and thank you for what you and your staff are doing.
Thank you. Councillor Jubb.
Thank you, Madam Chair. And through you, just a question to make off of what our CAO mentioned about not having to do MOUs. And I understand that it takes a lot of time and to get those. Regarding offsite security, are we going to see anything coming specifically regarding offsite security? And I go to the Oshawa last year when Regional Council approved, I think it was $500,000. Oshawa was in need, and I voted yes for that as well. Are we going to see something come forward to bring something to this table?
CAO.
Thank you, through you, Madam Chair. No, we are not bringing anything forward with respect to private security. The situation in Oshawa is somewhat unique, but also the security was provided on an interim basis while we staffed the outreach workers, which were now up and running as of January 1. So we are monitoring that program. Again, if needs arise that are not being addressed with the structures we have in place, we would certainly meet with local municipalities. But our preference is to invest our limited dollars on providing shelter and space for the unsheltered as opposed to private security.
Councillor?
Okay, thanks for that, Madam CAO. Yeah, I totally understand that. So basically, if a lower tier sees some issues that are not in any policy, bring it forward to the region and see what we can work out, just like kind of Oshawa did.
Yep. Yeah, that's correct.
Okay. That's all, Madam Chair. Thank you very much.
Okay, thank you, Councillor Jubb. Mayor Carter.
Again, thank you, Madam Chair. Just a question through you to our Commissioner or CAO. Will we have another policy coming forward in regards to warming stations and hubs, or is this the start and the beginning and the ending?
Commissioner?
Yes, through the chair. I would say at this point, it would be on a case-by-case basis, Mayor Carter, unless we see that there's a need for another policy and unless this committee and or council requests one.
Now, it also doesn't preclude anyone that is either on Health or Social Services or Regional Council to bring a motion or an amendment or a notice of motion forward in regards to if they see need to do so. Is that correct?
Through the chair, yes, that is correct.
Okay, and I think Mayor Foster brought up a very good point. What we're trying to accomplish and what we're doing also needs public support, and we've got to do a great deal of work as the chair knows that the amount of work that is needed to be done in the surrounding areas plays a significant role in regards to the public embracing the opportunity to be welcoming or supportive of these initiatives. So warming stations play a significant role in regards to meeting the needs, but also at the same time, having the public support plays an important part. So I appreciate that and just the clarification. So thank you.
So I've actually heard both from yourself, Mayor Foster, and Mayor Schumer with relation, one, to public input, second, to somehow a policy relating to warming centers. But at this point in time, for the warming centers, would it be one that we would follow up and as we are coming out of the warming center time period and looking into the end of the year into next year as a potential of having that as a direction to look at a policy potentially for the review of where we're dealing with situations? Commissioner?
Yes, through you, Madam Chair. Perhaps we can do a follow-up presentation on a status of the warming centers this past year, what we saw, what we learned, and we can share some of that information. We do plan to bring a report in June
Okay.
on homelessness, and we can do a second one then.
So if we can hold off to the June time period and get the presentation, at that point in time, if we feel it necessary to have any type of policy to be investigated for warming centers, we make that request in June. But for the second component of this policy specifically, I would like to understand, what does this mean for seeking public input into this? Is it to send it out? Is it to have online submissions, or is it to actually tie it maybe potentially into the full presentation in June, just to talking about an overall component? Like I need to understand, what does this actually look like in terms when you talk about what that for the public input onto this. I don't know, Mayor Carter, and I know Mayor Foster is waiting to make a comment too.
Yeah. Madam Chair, I'm just wondering, is if there is an evaluation when it comes to the warming stations or cooling stations or the hubs, I think it would be valuable for local municipalities to be asked for their input and data that we may have, because we collect a lot of data. And I think that would also be able to have a lot of information that our team could find it very supportive. And that I think would be vital in regards to, I know on our end, I'm going to presume at everyone else's end. So I just encourage staff that as they go through this process, let's make sure local municipalities have the opportunity to feed in, and so that we have a true picture of what's going on. So that's my opinion.
Okay, I appreciate that. Thank you, Mayor Carter. Mayor Foster.
Thank you. Yes, I'm going to echo exactly what Mayor Carter was speaking to. So I'm not in this piece of it as concerned with the feedback from the public, but the feedback from the municipalities. So I wonder if prior to the report coming out, there's the opportunity to reach out to the lower tier. So I know Clarington, and it's a fraction of what Oshawa has had and other municipalities have had to do, but Clarington is bearing the costs, some cleanup costs, and will continue to do so, and some security costs. So I think gathering that information, the experience of the lower tiers, will help to inform the report that is coming later, and perhaps help us to come forward with the appropriate policies. So my thinking is more around engaging the local municipalities. Two ways, their experience, and please share what we're learning from all of the other municipalities as well. Madam Chair, thank you.
Okay, appreciate that, Mayor Foster. Councillor Brenner.
Thank you very much, Madam Chair, and through you to, to our Commissioner. When reaching out to the lower tier municipalities, and again, I'm not sure if this is a similar model in the other municipalities across the region, but in the city of Pickering, we actually have a dedicated advisory committee that now has a subcommittee that is actually looking at homelessness and looking at community feedback and engagement. So in reaching out to the city of Pickering, hoping staff will utilize the model that we've now put in place, and take a look at that model and see how it does work in terms of engaging and working with community to develop successful solutions, whether it's for warming stations, cooling stations, transitional housing, shelter beds, any of that. It is frontline, but it is community-based, and it's a great model to look at.
Okay, thank you.
Thank you.
Mayor Schumer, did you want to make a comment too? If you do, yeah, I need you. Mayor Schumer.
Sorry, are you as far as the consultation and input?
Yes, yes.
Well, I would wholeheartedly agree that before this gets approved at regional council, that input should be solicited and received.
So I think that there's two. This is the shelter component or the warming center component.
Well, I kind of think both. I've been reaching out to our staff, and they don't seem too aware of this policy or its draft form or any consultations. So now I will, I'll go back and I'll double check that, because we did have a switch of CAOs at the beginning of the year. but I would like to make sure that consultation has happened at the municipal level. Regional CAO did indicate perhaps it could happen through the liaison committee with the supportive housing. But that is not, in my opinion, the same as consulting with the municipality itself.
Okay, all right, thank you, Mayor Schumer. So what we'll do is we'll take this away after this, and if it needs to be brought forward at regional council, we can bring it up at that point in time. But I think in the interim, we can look at making sure that consultation does take place.
Thank you.
Yeah. Anything further? As amended, all in favor? Any opposed? And that is carried. We have no resolutions, no confidential matters or other business. Actually, do we have other business? Move adjournment by Chair Henry. Oh, Mayor Carter. Other business?
Madam, the other business is just a moment of thanks. I just want to say this. Through the complexities that all of our communities are facing, our outreach teams are doing an extraordinary job. Not a good job, not a great job, an extraordinary job. And the work that they've been doing 24 hours a day, 7 days a week is making a huge, huge difference in regards to dealing with the most complex health issue we've ever seen in our community, and I think across Canada. And I just want to take this opportunity to thank everyone that supported the outreach workers, that believe that this was an important initiative to be able to make sure the region invested in this particular area. The selection of the individuals has been extraordinary. And on top of that, it's making a huge difference, not only in the great city of Oshawa, but it's making a huge difference across the region of Durham. And I think that we should celebrate the work that they've done. It's just been incredible. And I know that we're making a difference. And the individuals that are having the point-to-point contact with those individuals, I think for the first time, those individuals that are so lost, our outreach workers are actually helping them navigate so that we have an opportunity to create new pathways, that trust. So I didn't want it to be ignored today. They are doing an amazing job, and I'm so grateful for everyone's support and their vision in regards to this initiative. So there's a lot of congratulations that need to happen. But Madam Chair, if you wouldn't mind, I think it would be great if there was one way that we could recognize the outreach workers somehow and just say thank you for their work. So take that under advisement, but I just wanted to share that with you this morning.
Thank you, Mayor Carter. And I also want to echo the comments. And I think there's a lot of going over and above in their roles as well, too, and taking their role very seriously, but also very compassionately with how they are working with the residents that are out on our streets and wherever they may be. And I have heard many, many stories about their work. And even with, if I was to send out a request about where we have heard of homeless within the community, the response time, not only through the outreach workers, but through the staff around here, has been second to none to ensure that there's housing and shelter space put into place for those who are out on our streets. So thank you, Mayor Carter, for sharing that. And we do have a motion for adjournment from Chair Henry, seconded by Councillor Anderson, and all in favor. And thank you very much.